It's Jake Abra back on your screens. This time is the BFS clinic, and we are talking breast care and proper feeding posture. So successful breastfeeding depends on proper breast care, gentle hygiene, managing engorgement and nipple trauma, early detection of blocked ducts, mastitis, and much more than that. Felicia Marty Dodo is the principal midwifery officer at the Greater Accra Regional Hospital here to help me with that conversation. It's at this point, let me hand over our lovely baby. What's her name?
Baby Natalia.
Baby Natalia?
Yes.
Back to my Felicia. There you go.
Thank you.
So, we're talking proper breast care and feeding posture. What are the main goals of proper breastfeeding during the breastfeeding period?
Proper breast care and proper posture of the baby helps breastfeeding to be successful. The mother will be comfortable, and then effective breastfeeding continues, and then baby gets enough breast milk as the baby should get. Yes, with either than that, the baby will be put to the breast. You think baby is feeding or taking in more milk, but eventually baby is not, and it can lead to so many breast problems such as cracked nipples, engorgement, and all of that, and mastitis.
And also, it also impacts the baby as well. If
it's
they're
also,
not feeding
if you're not feeding the baby well, baby is not getting adequate nutrition, and baby becomes frustrated because of the position. Baby is not well positioned. Baby gets tired and becomes frustrated. So you see, when you put the baby to breast, baby comes out of the breast, and baby doesn't get enough breast milk.
Interesting. So what are some of the common mistakes people make when it comes to breastfeeding? The posture. Yeah.
Yes. So, we have so many breastfeeding postures, and we are not sticking to one as and when you are comfortable with a posture. But the common one is a cradle position, whereby most women use in our setting. So there are so many breastfeeding postures. Let's take a pregnant a mother who is recovering.
The cradle hold you are just referring to?
Yes.
Okay.
That's the most common one most mothers use. So a mother recovering from cesarean section, yes, because of the cuts, the wound, the baby, and the pressure on the wound when she sits to breastfeed the baby. So in that case, the mother can lie side by side with the baby, the football hold or laid back position, which will also promote effective breastfeeding.
Oh, double football hold, is that for twins?
Yes, for twins.
Okay.
For twins.
The football hold. Interesting.
Yes.
It's like they're holding it like
they're holding it like a football.
Like they are keepers.
Yeah.
Well, okay, so this is a cross cradle.
Yes,
how does this one help? Yeah.
So the cross cradle is when you hold the baby this way, the baby feeds from the opposite hand.
Okay.
Yes. So the cradle is this way. The baby is held in the arm, and then the breast that the baby.
So
the cross cradle, baby is this way, and is taken to the opposite side of the breast to feed.
Why can't they just do the cradle one instead of the cross cradle?
We have mothers who have issues with their shoulders, their arm. So this way puts a lot of pressure on the baby. So this way is also comfortable for mothers who have shoulder pain, backache, and all of that. So they hold baby this way, supports baby with the head, and it also promotes good attachment, especially for mothers who are, let's say, first-time mom, putting babies to the breast this way. Baby is not deeply latched onto the breast. They find it difficult using their hands, and then baby is not getting the parts of the areola that is supposed to enter the baby's mouth. So this way also helps first-time mom. They are able to see and support the baby's head to get enough of the part of the breast that's supposed to go into the baby's mouth. That's the nipple and almost all parts of the areola.
Okay. So we've got the cradle, the cross cradle, the football hold. Which other ones are?
So the laid back. So a mother can
just relax?
Yes, relax. And put baby, and baby suckles from the breast.
But I won't the baby fall asleep or anything like that?
No, so when you are doing that, you have to be in a chair that baby, when you are falling asleep, baby is protected. So in a bed, but if you have to practice this when you are fully awake. Yes, fully awake.
Okay. And we don't want any accidents.
Yes, any accidents, prevent baby from falling.
Because you are laying back and before you realize you are asleep.
Yes, you are off.
Which other one is there? Or which common mistakes do people make?
Common mistakes people make is that the breast milk is associated with how you feed food that prevents breast milk, food that promotes breast milk, but breast milk production is a thing of the mind. It's a feedback mechanism that is given to the mind, and it's a signal given to the mind that baby needs more milk, so produce. Baby needs more milk, produce. When you are able to position the baby well and to attach baby to the breast well, baby is able to feed effectively and gets the right amount of the milk that is supposed to feed. So let's take, for instance, a mother position a baby, and baby is what? Only latching on the nipple. Baby is not getting enough breast milk. You have to position the baby in such a way that the baby's ear, shoulder, and hips are in line. Then you support your baby with your palm supports the baby's buttocks, and then the baby's stomach touches your abdomen as well. And then you latch the baby. When you are putting the baby to the breast, you use the nipple to touch the upper part of the baby's lip. So you see baby opens his mouth widely open and then takes enough breast milk. But most common mistake most mothers do is that they try and push the breast directly into the baby's mouth. So you see that at that point, baby's mouth is not widely open. If baby's mouth is widely open, it's like you are yawning. It's, yes, to give it that shape. But when baby's mouth is in the O, like the O shape, that means the breast is not getting into the baby's mouth as it should.
Okay. So earlier you mentioned the fact that when we position correctly, it helps with attachment and all that. So how does that attachment and then, the latch help connect with the baby and the mother? What other role does it play?
So you see, when you attach the baby correctly and the baby latch onto the breast very well, you see that the baby's upper lip is turned outwards. And then more of the areola is visible up at the upper part of the breast than the lower part. When you see that the areola is showing more at the lower part, that means baby is not latching well, and then the chin have to touch the mother's breast. In that case, you see when it goes at the upper part of the baby's mouth, it promotes a lot of what? The breast milk goes directly into the baby's mouth. But when you put the breast and it goes into the baby's mouth, it touches the center of the baby's mouth, it touches the upper part of the hard part of the baby's, the root of the mouth. So you see the mothers feel pain.
Oh, okay.
Yes,
okay.
so you see some mothers breastfeeding and they are making some yes.
Yes. And they still have to feed.
And they still have, no, when you see that, then that means baby is not properly positioned or attached.
It's not properly positioned.
So you have to break the latch. So with your clean finger, the little finger, you put it at the side of the baby's mouth gently, and then you see baby eat. But when you pull the breast out of the baby's mouth, you can get sore nipple, which will make breastfeeding difficult. And then that is when mothers introduce other feed, because they think baby is not taking them. When they put the baby to breast, baby comes off. They put baby to breast, babies come off. So baby get frustrated, mother gets frustrated, and then they resort to other breastfeeding options, which is not good in the first 6 months of the baby's.
Yeah, they introduce the formulas too early.
The formulas too early.
Yeah.
But when you position baby and baby is well attached and latch onto the breast, you can do breastfeeding, and then more breast milk will be produced.
Yeah. So is there a situation where perhaps the mother's nipples are bigger than the baby's lips? Maybe that's why the proper feeding is not going on.
Yes, we have a breast anatomy. For the women, we have sizes, the shape, and all of that. But some people's nipple is too big, and some people's nipple is too small. But it doesn't really matter. When you come, yes, when you come and then we ascertain, in as much as you can get baby to open the mouth wide for you baby to properly latch onto the breast, you can breastfeed. Yes. Either than that, if it's becoming a challenge, you can also express and then use cup and spoon to feed the baby.
Oh, that works as well.
That works as well.
Okay. Interesting. So you don't have to introduce the formulas and whatnot
too
early.
Because when you're introducing the formulas, most mothers, in as much as it contains, God in his own way knows that one day a woman will give birth, and this is the right amount of proportion of nutrients for the baby. When you are using the artificial feeds, it has a lot, the protein content is high, the sugars are high, so babies start growing, they get infant diabetes and a whole lot, we have putting pressure on the system, the breaking down of the feed, and then can result to a whole lot of condition when baby is growing up. So in the first 6 months of the baby's life, the right food for the baby is the breast milk, because this is not the time you are going to calculate what nutrient should I put in the baby's feed, what protein, what carbohydrates, what oil. But God has made the breast milk in such a way that even there's water in there. Mothers are feeding babies and they feel, oh, baby is thirsty, let me add water to it. No, the breast milk contains water. And some of the mistakes mothers do is that they put the baby to this breast, they don't let the baby, they don't empty the breast, and then they put baby to this one. The breast milk is made in such a way that the hind milk, we have the hind milk and then the fore milk. So when you give the fore milk to the baby have to take the hind milk. As well. So someone will say that is the soup and the banku. So when you're giving only the soup or the water to the baby, you have to feel that your breast is totally empty before you put baby to the next one. So let's take, for instance, when you are feeding a baby and a baby sleeps off, and this breast is not really emptied. When baby wakes up, you put baby to that same breast for baby to empty it before you take baby to the next one to suckle.
Is there any myth you've heard about breastfeeding that you want to debunk right now?
Yes, I think the most common myth is the cholesterol. That yellowish fluid, little one that comes out in the initial stage of the breastfeeding. A lot of women feels that part of the milk is a dirty milk. So even in some communities, they express and then they throw it away. But
that's still happening.
Yes,
because I realize you've made a lot of awareness
but
about.
But now it's better. We are creating the awareness, and people are getting to know that even at that point, when you give birth to the baby, the few months, baby needs just a little. We assume that their abdomen or their stomach is what? It's like an adult or bigger. No, their tummy is just like a fist of their hand. So when you're feeding the baby at the initial stage, the little one that you give is enough. And the colostrum also what contains a lot of protective nutrients that prevent the baby. It's like the first immunization, let me put it that way.
Yes,
so build the immune system. So mothers shouldn't express and throw it away. That is very essential at the beginning of breastfeeding, and they should breastfeed the baby with it.
So earlier you're saying if the baby is not latched on properly, use a clean finger, put it at the edge of the mouth gently.
Yes.
So speaking about cleanliness, what hygiene practices would you recommend when it comes to breast care and breastfeeding?
Okay, so let me say this. Breast care, if you're a woman and then taking your normal bath, you wash the breast. Breast care doesn't necessarily mean using disinfectants or perfumes to clean your breast at every feed. No. When you take your bath and then you wash your breast, when you're feeding baby, you have to perform hand hygiene. You make sure that your hands are thoroughly washed, because if baby is not latching well, you use that little finger, put it in the baby's mouth to break the latch, and then reposition the baby well to get enough breast milk. Yes, so you wash yourself, you wash your hands, and then when you feel that the work you are doing, you sweat a lot, when you're coming to feed the baby, you can use a damp towel just to clean around the breast. Not necessarily, and we have people who also believe that when the woman delivers, we have to thoroughly massage the breast for milk production to be initiated. No, it's a no. When you do that vigorously, you can damage the breast tissue, which can also lead to complications for the mother.
Interesting. So what about those who are perhaps suffering from engorgement? How would you advise them?
Engorgement, when your breast is engorged, that means you are not emptying the breast milk from the breast.
The fore and then the
hind. Yes, the fore milk and then the hind milk. So what you have to do that you don't discontinue breastfeeding. When the breast is so hard to be put in for baby to latch, you can express and then to soften the breast and then put the baby to breast. And then you can use when you do that, you can also express the other side, keep it in the fridge, and later use it to feed baby. So it doesn't necessarily mean when your breast is engorged, you stop breastfeeding. No, you have to continue breastfeeding to soften that, because the more the buildup of the milk in the breast, it can also lead to what? Mastitis and a whole lot, and that is a complication.
Okay, so then let's speak about the mastitis, like the blocked duct. Is that what that is?
No.
What are the early steps, or how do you know that this is what is happening? Yeah.
Okay, so with the blocked duct, you could see that a localized part of your breast was swollen, it's reddened, and you have to report immediately as possible. The mastitis, you see, people get the cracked nipple, they are not emptying the breast well, then it builds up, and then it becomes so hot to touch, so tender, shiny, and then you could see that if you're not careful, the sore, the cracked nipples become sores, and then infections goes into the breast, and that becomes a complication. But for the engorgement, you can soften the breast and continue putting baby to the breast to feed.
Cracked nipples, I wanted to, where does that come in?
So it comes in when baby is not well positioned. Baby doesn't latch onto the breast well. So you see that the nipple is at the center part of the baby's mouth, then it touches the hard part of the roof of the baby's mouth. So it causes pain, and then breast come into your nipples, and then it cracks. But you can also use, when it becomes, you have cracked nipples, you can also use some of the breast milk to lubricate the nipple, for it to dry, and then you continue breastfeeding. When you position baby well,
what are we looking at?
Yes, breaking the latch. Yes, because baby is not, you could see that baby's mouth is not widely open, so the mother is breaking the latch and reposition the baby onto the breast again.
So you just rub a little, you can even rub a little of the breast milk on your, that's when the crack happens.
Yes, some people have irritated nipples, irritation and all of that. So you can just use a little bit of the breast milk and then rub it around the nipple and the area.
And then the breast milk, there has a lot of things you can do.
Yes.
Wait, it doesn't mean going. Anyway. So
I have a song I'll sing for the men when I'm closing when we are closing the show.
Where are we? So, what would you recommend for ladies who are facing challenges but are not really sure what exactly is going on, and then they have to visit the healthcare facility?
Yes, so when you visit the healthcare facility, in our era and age of health system, I always encourage the women and I empower them to speak out when you come to the hospital. Yes, you know what you are feeling. You tell us your signs, you tell us your symptoms. Sometimes we see the signs, but we are not in your shoe to tell what you are. So when you come to the hospital, to the healthcare provider, feel free and tell them what you are facing. During the breastfeeding, we will also examine you and then give you the appropriate care and then help you out. Some is just when we teach them how to express, how to proper position the baby and attach the baby to breast, you see they are good to go. Some are not a big challenge at all.
Is there a case of, I've given birth, I know the breast milk is supposed to come from here, so it will be easy, and then they realize that okay, it's not as easy as it seems unless somebody teaches us the right way? Because I can assume, I just gave birth, I can just do this, and then.
So I'll say breastfeeding requires practice, and then when you practice, you become perfect. And it's not just giving birth to the baby and putting the baby to breast. During the antenatal care, we teach them proper positioning and attachments of the baby to the breast. We teach them the breast care. We teach them a lot of things, even during the antenatal. And when you go to the delivery room and you deliver, we encourage skin-to-skin contact. And we advocate that within the first 30 to 1 hour, baby should be put to breast. If mother is fine, baby is fine, you should initiate breastfeeding. So on the ward, we assist mothers before they go home. They get they get to practice, and then they are okay with how to position baby. However, when you go home and you are facing challenges, you can come back or call your midwife. Now there's telemidwifery, telenursing. You can even give your midwife a call or your healthcare provider.
Or video call and everything.
Yeah, we can assist you, support you with some videos, teach you some techniques. But if still you are facing a challenge, we can ask you to come to the health facility so that we can properly assess the breast. So when they come, sometimes we tell them, how do you feed a baby? Okay, position the baby to the breast. Let's see how you do it, and then we can correct the mistakes that you are doing in attaching and positioning the baby to the breast.
Okay, so what advice do you have for women who have inverted or flat breast?
I would say that when you have inverted or flat nipple, it doesn't mean you cannot breastfeed. You can breastfeed. When baby, we teach you the technique, baby widely open the mouth. With time, you see baby gets to breastfeed and baby gets used to the type of nipple that you have. So we'll tell the mothers not to be discouraged, but when they come to the antenatal clinics, they should report it to their healthcare provider. We examine and then we help them out during the antenatal, during the labor, and then the postnatal period. Okay. So it is not a no that I have a flat nipple, inverted nipple, so I will not breastfeed my child. So I'm going to resort to artificial feeds. No. For the first 6 months, I'm emphasizing it again that the breast milk is the right nutrients for the baby, because the baby's even intestine breaking down this complex nutrients. The breast milk is safe. You don't need to go to the market to search for it, going to here, getting the feed. It's readily what's available at any point in time. So you see, when you position the baby also well, it prevents the mother from having backache, neck pain, and baby also don't get frustrated. I have mothers asking me, what about, you give birth to some babies that they are too heavy, they are weighing much. So the mothers easily get tired when they put the baby to breast or when they hold the baby to breastfeed. You can use the normal pillows that we have in the house, the breastfeeding people, you let the baby rest so that baby can come up a bit to touch you, and then you are also relaxed, but you lean back. Mother shouldn't bring the breast to the baby, but rather bring baby to the breast so that you can sit comfortably and then breastfeed the baby.
So what would you recommend for, I know how important it is in the first 6 months, or perhaps you had a cesarean section or you had a surgery just before you gave birth. I know I've read of situations where perhaps you took some fibroids out and, you're still undergoing medication or something, but you still happen to be pregnant. So for that, what posture would you recommend when it comes to breastfeeding in situations like that?
So if you're recovering from a cesarean operation or cesarean section, you can go with the football hold or the cross cradle. So you sit and laid back, or the laid back position, so that doesn't put pressure on your wound. And let me speak to this. We give birth to babies who mothers are not well, mothers are unwell, maybe they have a traumatic birth, or baby has a condition, baby has to be sent to the neonatal intensive care unit. If baby is there, artificial feed is given under strictness, it is being calculated for the babies to feed. So under that circumstances where mother is unwell, mother has a complication, baby is unwell, baby is detached from the mother, even we encourage mothers to go, if mothers are well, go and express, and that breast milk is used to feed the baby. However, if mother is not in that position, we do it under strict direction. Okay. We know how to feed the baby, the intervals, the quantity. But when baby is well, we encourage that mother should continue breastfeeding. I have mothers who say, when my baby was at NICU, they gave baby a breast milk substitute. So as I'm going home, I'm going to know you have to discontinue when you are fine. And mothers use a whole lot of things aside the infection. As I spoke earlier on, the sugars are too much in the breast milk substitutes and all of that, which give infants diabetes and health conditions. So the breast milk, I will emphasize again, is the ideal food for the first 6 months of the baby's life.
So you mentioned earlier just a moment ago about how sometimes the babies are heavy, so they have to use the pillows, the cushion and whatnot. What about other cases where the breast is heavier, so it also weighs on the mother?
Yes. So as I talked about the breast anatomy, some people have extremely big breasts. And the size of the breast doesn't determine whether you produce more milk or less milk. People think when you have a smaller breast, you are going to produce less or you are going to produce more. When you have a bigger breast, you are going to produce more. But when you have a bigger breast, sometimes position the baby, the breast can block the baby's nose, and then breathing becomes difficult. So you can use the football hold or the cross cradle. That one you can be in control of the baby's head. And mothers, as I said, when you are breastfeeding, these 4 fingers should be under your breast, and then the thumb should be up. But you see some mothers using their fingers to press. You don't need to press. Either than that, baby doesn't latch well onto the areola.
Okay. So, in what situations will the mother need some other tools, perhaps the breast pumps and then the nipple shields?
Okay, so I'll say the nipple shield is not the first line solution when you have challenges with your nipple. Sometimes we need to assess the mother to see whether they can even reposition the baby to avoid even using the breast shield or getting cracked nipples to lead you to have going to use the breast shield. But the breast pump, some people in the early stage of the delivery, getting breast milk is a challenge. Position the baby to breast, and baby is not latching well. So in that instance, you can use the breast pump to express and then put it in a cup and spoon and then feed baby with it. Yes.
Oh, okay. So speaking about that, are there situations where perhaps after birth, maybe the mother is suffering from no milk or low milk, or there are no situations like that?
Generally, a lot of the mothers in the first few days, struggle with position or getting a breast milk flow for the baby. So you see, it doesn't necessarily, as I talk about the cholesterol, that's little yellowish milk that comes out. Just give it to the baby, and that is enough for the baby. And the more you put the baby to breast, the signal is given to the brain that baby needs milk, produce more milk. And then within a day or two, you see that the breast milk is flowing. So it's not a big challenge. In the first day, when you deliver, maybe because of stress, traumatic birth, and all of that, you need to rest enough, and then still put baby to breast. You do it, consistency is the key. So the more you put the baby to breast, the more then the feedback mechanism comes, give the signal to the brain, and the milk production is what is being, the milk flows out to the baby.
Yeah. So we have about a minute to go. So we just recap, show us the proper positions again, the football, the cradle, the cross cradle, and all that. Then we can bounce out of it.
Okay, so the cradle position, when you take your baby, you have to make sure that baby's face is facing you, the baby's chin is touching your breast, and make sure that baby's ear, the shoulder, and then the hips are in a straight line. Baby's tummy touching your tummy, and then when you are putting the breast into the baby's mouth, you use the nipple to touch the upper part of the baby's mouth. Then it signals the baby. You see, baby will open the mouth wide, and then you insert the breast, the nipple, and then the areola. So this is the cradle position, and then the cross cradle is the opposite. So you position baby on the opposite hand to the breast. So this way, I position the baby, I hold baby's head, I'm in control, and then I feed baby with this. The football hold is this way. It's like you are holding a football in your armpit. So you put the baby in your armpit, you turn the head towards your breast, and then you feed the baby. The laid back, as I said, baby is it's lying on your abdomen. You turn the head to the breast that baby needs to feed from, and then you feed baby gently. It's all comfortable for the mother and the baby as well.
Yeah, thank you so much, Felicia Martin-Dodo, who's the Principal Midwifery Officer at the Greater Accra Regional Hospital, and to you, baby Natalia. You've been a great guest. You didn't cry too much.
Yes. He's always smiling. But my song.
Do the song for us so we wrap this up. Yes.
My song is Maobanu nufunso fiti dao bewo no fiko sibo sumisa enfa bibianka ho Maobanu nufunso fiti dao bewo no kudiko sibo sumisa enfa bibianka ho nufu to tetia wontem nufu so mankranyansa nufu so ya bofra dia enye papa no dia. So that is my song.
Wait.
They say nufu so ya bofra dia enye papa no dia.
I don't know how to respond to that. So we'll argue behind the scenes. Before see, we are going on a break. Thank you so much for staying. We'll be back after the break. Thank you.
Thank you.
What? Wait.